Good evening. And first, thank you for the opportunity to be here tonight to speak to such a well-informed, I'm sure, and enthusiastic group of people around this particular topic. And thank you to the organizers. You've obviously done a very good job, because this is probably one of the best well-attended all candidates meetings we've been to, so you certainly did get the word out, and that's great. Just a little bit about myself, and it's strange to hear what people know about you now because of the internet, so your whole world is out there for the world to know you, but there are a few other things as well. I also worked at a Centre for the Developmentally Disabled at Barrie Regional Centre for a number of years, and that's where my actual training was before I went to, I worked in occupational therapy there, and then went to work at what was then known as Family Benefits, and then for the Ontario Disability Program until 2010, when I was able to retire. And you know, one of the things about running in this election is the things that you don't know about the riding that you live in. And I will certainly say that this is one of the things I didn't know about, was this coalition, because it is 2009. And it's a wonderful thing that this is there, because when I worked in the Ontario Disability Support Program as a caseworker, I saw daily the challenges that faced the youth of our area, and how the challenges were different depending on where you happen to live and what kind of a home you happen to live in. So it's great to see that there is this coalition happening in this area. Just now getting political, because this is why we're here, is about being political. So I'd like to talk to you a little bit about the NDP and why I believe that Ontarians believe it's time for change, real change in this province. We could continue to elect a government that puts forward the same ideas and wants to spend monies in the same area that don't put people first. Or we can elect a government that thinks about spending the money that put people first, and that would be the New Democrats. This very organization of a meeting here tonight shows that there are real concerns in the areas of putting business first before we put people first. The NDP has a history of working with those in need, of putting the needs of everyday Ontarians ahead of corporations or CEOs. That money that is being collected should be used and freed up for services needed for children's mental health, as well as overall mental health. Much of the NDP platform leads into increased funding to be proactive rather than reactive. Our children are our future. We need to invest in them at an early age. If we do not provide supports that will help them through their early years, we will often be supporting them in later years. And at that, I would just like to leave it and say thank you, and I look forward to hearing your questions.
Thank you, Doris. The population in Simcoe County doubled from 1996 to 2006, according to the last census. And it has certainly risen since then, yet funding has not increased for services to support children and youth. It's anticipated that our population by 2036 for children up to 19 years will increase by an additional 37%. How will you ensure services for Simcoe County's children and youth, that they receive the funding that's required to decrease wait times and provide them with the services they need now and in the future?
I'd like to read a couple of quotes that my leader, Andrea Horvath, the leader of the New Democratic Party, has stated. The McGuinty government acknowledges there is a crisis in mental health funding and has promised to fix the problem. Then why is the government idle while drastic cuts are being made to the very services family needs for treating their children's mental health issues? The autism program in Ontario needs an independent review to ensure all children receive the IDI they require. So I guess it depends on what side of the political spectrum you're on as to whether or not there has been enough money put into a system or whether there hasn't been. And as I'm sorry that my green colleague says, the easy fix to it is, yes, we need to increase funding. But I think the other part of that as well, and this may not necessarily be my party's point of view, but sometimes is the identification, I guess, of what the real issue is. And part of that is, probably is a problem within the system as to what do they actually need service for. I was actually quite pleased when I attended the You attend lots of things when you're on this circuit. With Royal Victoria Hospital, they brought all the candidates in, and I guess what's happening there is there's a child and adolescent mental health unit that will be opened coming up, which I applaud. But I guess in the past, and it's still not that large of a unit, people have been sent all over the province, young children, because there is nothing in the area, and young children and adolescents need to be close to home when they're going through crisis. That's extremely important, and that's not happening right now. So all I can say is that my party, as history has said, will be proactive in working alongside to see where the funding is needed in Simcoe County.
The microphone stays with you, Doris, and actually you sort of touched on this, so you might want to expand a little. Our next question is about children's mental health. 40% of identified children and youth with mental health challenges are not getting the mental health help they need. 70% of all adult mental illnesses have their onset in childhood and adolescence. These children and youth are then entering our adult system with issues that could have been prevented. So how will you support more early intervention programming for these kids at risk? Doris?
I guess I kind of half answered it in my first response, but there needs to be more venues, I guess, to be able to identify that. I know from, I'm not an educator in the school system, but I know sometimes there's frustration within the school system as to how to identify or how to move forward or how to have somebody come in for service. So that is certainly something I maybe the coalition is something that will be able to assist with that, with people all working on that together. The NDP is committed to making waiting lists in any of the healthcare fields much less, whether that be by encouraging and giving some kind of reward for people to go to school so that there will be more people in those healthcare fields. Funding family health care clinics where people can actually go if they're 24 hours a day, and there is an actual clinic where people are able to go, rather than having to travel to an emergency ward that may not be open or have a crisis through another area is probably another one. And just strengthening the transparency and enforcing accountability in the healthcare field so that we know that the dollars that are being spent on that are being spent wisely and aren't being spent on e-health consulting fees or whatever it may be, that we need to ensure that the money is spent appropriately and that the services are offered so that the intervention, as my Green Party colleague said, it is important to identify it at a very early age because providing supports at an earlier age certainly assists in later years. Thank you.
Given that education of our children is a shared responsibility, what do you believe contributes to this in our area, and what would you do to help improve it?
I agree with a little bit of all three of the previous speakers, and I certainly agree with Fred when he talks about poverty and expectations in the area. The area is not a high employment area, so the jobs that many of the students parents have of the students does sometimes not provide a very high quality of living for students, which, as we all know, that creates a whole bunch of issues as far as security and support and food when they're going to school, if they're hungry, whatever. So that certainly, that whole circle of poverty certainly impacts that. I would also agree with the lack of post-secondary education in our backyard. Until the last few years, that didn't happen, and as we all know, the big piece of going to school is not, well, it is getting to the point that tuition is becoming much too high, because we have the highest tuition rates in all of Canada, which is another issue, but the other high part is, of course, the paying for accommodation and food and whatever, and if you're struggling to go to school, you certainly aren't going to be able to do it if you're you have to go away from home. And just basically the demographics of the area, and I guess sort of the expectations, you know, depending on what has sort of gone on for a long period of time, it sometimes is, if you know you're not going to get a really good job in your area because that's not what's there, then sometimes the expectation of doing really well in school and moving on just doesn't seem to be there. So let's hope we can break this. Let's hope that it will improve, and let's hope we're able to provide the supports so that the young people in this area are more able to succeed.
Thank you. Your next question comes from the audience this evening from the floor, and the question is, how will your party ensure that Ontario's income security program provides enough support for people to meet their basic needs for housing, food, transportation, clothing, and other day-to-day expenses?
Security program, you said income security?
It was Ontario's income security program. Absolutely, Doris, thank you.
We've had similar question to this at another all candidates meeting that we were at, and the one piece is that the NDP is definitely looking at wanting to have the minimum wage increased. That is something that needs to be done, and if supports need to be provided to employers, then that will happen. Even at $11 an hour, I think people will still be living under poverty, at the poverty line, but at least it's better than what it is right now. The social assistance rates should be kept in line with inflation. And actually, I believe it was yesterday, there was an announcement made around affordable housing from the NDP. If I remember correctly, it was to do with ensuring that there was more affordable housing available, as well as providing some income support or some shelter support to people if they weren't, if it wasn't in public housing. It's important, and the NDP is committed to ensuring that people do live above the line of poverty, because as we've talked about in the earlier questions, if that doesn't happen, there's a whole circle of other events that happens, and people are then not contributing to the economy as well, because they just aren't healthy. And poverty is certainly has been proven that people are not as healthy, either mentally or physically. So we need to ensure that that happens. Thank you.
The next question also comes from the audience, from the floor this evening, and it's very specific, and it relates to fetal alcohol spectrum disorder. It's a term that describes the full range of harm that can be caused from a birth mother drinking alcohol during her pregnancy. At a prevalence rate of 1%, 4,386 of Simcoe County's population could be impacted with this lifelong yet preventable disorder. Economic costs associated with it are estimated at over $1 million per individual when it comes to social service, health, and education costs. We know what causes fetal alcohol spectrum disorder. We know how to prevent it, diagnose it, and we're learning about more and more promising practices related to effective intervention. What is your position on fetal alcohol spectrum disorder and on developing an interministerial approach to address it?
Well, I know a little bit about this from my past work, and my understanding is there certainly has been huge, well, not development, but a huge, much better understanding. It used to, in the early, when it was first identified as fetal alcohol syndrome, it was looked at as being more with, for lack of a better phrase, lower income people. But we know now it doesn't. This is everywhere, and many of the disorders that are as a result of this are things that weren't identified in the past. So I guess it's almost at an epidemic level, and that's part of the crisis with it. And we're dealing with a very, very strong addiction. It's easy to say, I'm pregnant and I'm not going to drink, but if somebody is a severe alcoholic, that's something that needs to be dealt with in a much more consistent way. So we talk about education, we can talk about prevention, we can talk about putting things up on the wall in bars and doing whatever, but I think it's something that requires some intervention in some way when it's now at this type of a level. And interministerial, I would assume that would probably mean Ministry of Health, Ministry of Community and Social Services, the Children and Youth Services, whatever. Same kind of way, the more people that you have that are on board to put funds and put resources into somehow bringing this into, or somehow lessening this, because as it's been said, it affects a child for the rest of their life. And not just that child, but their family, and whatever, it needs to be done. And I think we would certainly be supportive in that consultative approach, to say the least.
Our next question also comes from the floor. Doris, stick it to the microphone. And it's with regards to families dealing with adults who have developmental disabilities. And the question is, there is a serious lack of supports and services for adults with developmental disabilities in this city, county, and province. Once a person with developmental disabilities finishes high school, the year they turn 21, they are adrift, and their families are left with 100% of their care. It is next to impossible to pay someone $10 to $15 per hour to care for this family member while you're working full-time. There's not enough funding to cover this, and therefore absolutely nothing available for respite. What funding and supports would you and your party plan to provide?
Certainly has, certainly is an area that there is not funding for, and this particular area has had funding cuts, I believe, over the past number of years as well. So I think part of the problem is, once they're 21, who's responsible for them? Is it, and you know, where does the money come from? So that's part of the issue. I mean, we need to look at the kinds of supports that are available in the community and the kinds of agencies that we have out there that can provide those supports. And certainly, it's you know, it's always much better if you know, if it gets to the point sometime that it becomes too difficult for somebody to keep their child at home or to keep their young adult at home. We all know that it's very difficult for them to put them into a group home or whatever. So we should be finding some way to do it, because first of all, it's much better for the parent, it's much better for the young adult, and it's much better for the community as well if they continue to remain in their home. And frankly, it's much more reasonable as far as cost goes than putting somebody into that kind of a setting. So I would say that we should probably look at exploring what resources are available and exploring this type of care. There's a great deal of lobbying that can go on with your politicians, and they'll be fresh after this October 6th. So get your lobbying kids together and get down to Queen's Park and lobby whichever one of us happens to be there.
Our next question, again, this is from the audience, from the floor this evening. As municipal leaders and service providers, we know how devastating the mid-90s downloading of social services to the property tax roll has been to our communities. Now that the uploading of this responsibility is underway, there is grave concern that a new government could slow or even stop this realignment. This question requires a simple yes or no answer. Does your party and your leader commit to continuing the current $3 billion social services uploading agreement regardless of any change in Ontario's economy?
Let's be honest.
Andrea Horvath and the New Democrats say yes.
That was a quick one. Already, question number 8, and then Doris will start with you. This is again about children's health and mental health issues. There's a significant lack of professionals to address children's mental health and health needs in Simcoe County. How would you address the need for the following? And there's 4. Pediatricians, children's psychiatrists and psychologists, children's hospital mental health beds. This is the only local health integrated network, the LHIN area in the entire province that lacks child and adolescent mental health beds. And the fourth is child and youth workers, social workers.
How would we address this? Well, part of the NDP platform is to provide some kind of relief to doctors for going to more rural areas. So I would hope that that may in some way entice some doctors to come to this area. We may not exactly call it rural, but it certainly isn't downtown Toronto. So by forgiving of some tuition fees, we hope that would happen. As far as psychiatrists and psychologists, and I think probably part of the problem with that is the number of people that aren't going because of the high tuition fees and the high cost of going to university. If there probably is a shortage of them in the province, I don't know that for a fact, but I'm sure that's probably part of it. And we're not having them because it costs too much money. People will, I know I had a relative who was thinking about going to medical school and decided not to because it was astronomical by the time he was, would have completed with that. As far as children's hospital mental health beds, as I said earlier in my, I think it was the first answer, I hear that we are actually going to have a couple or under 15 in RBH, which is probably great for the first time in a while, but that we would, that still isn't good for somebody who lives in Collingwood or Orillia or Midland. So there would need to be some kind of I guess negotiation in the area to try to have them there, because I really do believe that children's mental health beds should be close there. It's even more important for them to be close to their home than adults. And children and youth workers, social workers. I think part of the problem there is wages. And the part of the wages for some students when they come out from the child and youth worker program is that it's quite low, and when they work in private agencies, it's quite low. Wage parity with people that work in Sheldon Halton institutions is much lower, and there's a couple of different ways that that can be addressed. My background is union, part of it. You know, collective bargaining and a unified voice in doing that is important, and I really do believe that child and youth workers are underpaid for the value of work that they have.
Thank you, Doris. Mental health services for children and youth, apparently a big concern to the people in this audience. We have another question relating to that. Suicide is the second highest cause of death in young people. In Simcoe County, there are no mental health beds for youth, as we've heard, and they are actually sent out of the area to South Lake Hospital in Newmarket. The coalition has developed a protocol to help ensure youth at risk get the help that they need. What will your party do to encourage a community-wide conversation about how to keep our kids safe?
I certainly would be involved in trying to, or being involved in coordinating if I was the person to be elected, or being involved in any assistance at all. But the only thing I could add about suicide is it's good that we're starting to talk about it more. It's good that the stigma seems to have been removed from it, and you know, unfortunately, some of that stigma has been removed from it because famous people have committed suicide, and it's, you know, it's out there more because of the hockey players and the whatever that have had. But for whatever reason it is, when people are starting to talk about it, when people are starting to realize that there are so many different reasons for it, and you know, and the prevention of suicide. So looking at when people are depressed, that they should be able to come forward and talk to people about it and not be ashamed of it, because it's a condition, it's a human condition, it's nothing to be ashamed of. So that's probably the only thing that I can add to it, is that I'm glad to know that I think it's it's good to, it's not good that it's coming forward, but it's good that it's at least being discussed.
Thank you. This is our final question, again from the floor, from the audience this evening, and then we will have each of our candidates give a 2-minute closing statement, and there should be still a few minutes left over at the end to mingle and ask any of the candidates questions or for clarification on something that you have heard this evening. So the final question is on Francophone and Aboriginal services. Francophones and First Nations people make up 11% of the population here in Simcoe County. Services to these groups are sorely lacking when it comes to children's mental health, health care, and child welfare. The question is, what will your party do to address linguistically and culturally appropriate services by and for both of these constituencies?
The standard, I have had an opportunity in this election to actually visit some of the areas that I had never been to before, and one of them being Christian Island. And I'm fairly familiar with Rama just from my past work as well as living in the area. But I think one of the things that we need to look at is just how much we need to think about being part of them and recognizing their culture and working with them in that way. I guess it's really asking them more so what it is that they need rather than us telling them what they need. And I'm not sure if I got the question totally right, that you just said that it's been less services in those areas. Is that basically what it was?
Less services, and the actual question is, what will your party do to address linguistically and culturally appropriate services by and for these two constituencies?
Well, culturally, definitely with the Aboriginal community is to services much better if you follow the culture and work it in with the culture that they presently have. And I would hope that is being done. I've seen that being done in some areas. I would hope it is done more so than that. And our party certainly is one of those parties that certainly has worked alongside that community to try to absorb the culture and work with them in that way. As far as the Francophone service, I mean, I guess you could say it would be similar. I guess part of the problem is that the numbers or the ratio of people that are working in that service just aren't enough, and that's part of the issue with it. That yes, I do know that this is one of the areas that it should be. So, I mean, if it's legislated that it should be, I would imagine that that's what should be done. And if the legislation says we should be providing that service in that language, I certainly would be in agreement with that.
We will allow the candidates 2 minutes each for a closing statement. What we're going to do is we're going to do it in reverse order from the opening statements. And I know you weren't here, Garfield. I drew your number for you. I didn't speak for you, but I did draw your number for you. So the order will be Fred Larson from the Liberal Party, Garfield Dunlop from the Conservatives, Mead Hellman from the Green Party, and Doris Middleton from the NDP.
Well, I want to thank you for your questions tonight. You have certainly educated me in some ways with some of the concerns, the huge concerns that are happening in Simcoe County. And you certainly show your care for your work. I would imagine that most of you are workers in that field, and that's what makes that field so difficult, because you care for your work, you care for the people that you work with, and the money's not there. And I guess it's, again, or they say the money's not there, and I guess again it is, what do you choose first? Well, I think we choose people first. And it's important to take care of our people, and then many things roll from that when you have strong people that are healthy and that have services. So when you make your choice on October 6th, think of that. You can vote for Tim Hudak, who we know will cut, and will cut services. You can vote for Dalton McGinty, who says that he hasn't cut, but we know he has cut. And some of the money that has been spent in services have been spent at the top rather than at the bottom. Or you can vote for Andrea Horvath, who you know will put people first and will ensure that the services that are needed to be put in place will be put in place. And, or you could vote for the Green Party, which has a very specialized and important voice, but they will not, I think I would be safe to say they will not walk out of this town. Thank you very much for tonight.
Thank you very much. I'd like to thank the Child, Youth and Family Services Coalition for inviting us all here tonight to learn about some really important issues. I'd like to thank you to the candidates for coming to enlighten us about your party's policies on these very important issues. And thanks to everyone. In this room who was interested enough in those very important issues to come out to listen and to learn. I hope you all leave the meeting this evening better equipped to make an informed choice when it comes to casting your ballot on October 6th, and by all means, please cast your ballot on October the 6th. Thank you very much.